question here. The nurse employed in the emergency room and is responsible for triage of the 4 clients. So these 4 clients injured in a motor vehicle accident. Which of the following clients should receive the priorities of care? So this is the 4 patient. Which one you have to go first? Prioritization question. Number A, 10 years old with laceration of the face. B, 15 years old with sternal bruises. Number C, 34 years old with a fractured femur. And number D, 50 years old with a dislocation of the elbow. The correct answer is B, right? The 15 years old with a sternal bruises. So why we support 15 years old sternal bruises is the emergencies, right? So I said the sternum, or it is called the breastbone, is the flat bones located in the center of the part of our chest. So if this bones is broken or injured, our lungs get infected. So shortness of breath is most common for this. So the teenager with the sternal bruising might be experiencing the airway and oxygenation problem, and thus should be seen first. Answer A, 10 years old with laceration has superficial bleeding, right? It is not a life-threatening. The client in answer C, 34 years old with fractured femur, should be immobilized, but can be seen after the client with a sternal bruising. A femoral fracture is a bone fracture that involves the femur, right? And they are typically sustained in a high impact trauma, right? So, and last one, the dislocation of the elbow. So a dislocation elbow occurs when the bones that makes up the joint are forced out of alignment. So it is medical cause, but not the emergencies. So the client with answer D with the dislocation elbow can be seen later as well. What next? Which of the following room mat should be most suitable for the client with a myasthenia gravis? So, client with a hypothyroidism, a client with a Crohn's disease, a client with a pyelonephritis, and a client with a bronchitis. So the correct answer is a client with a hypothyroidism. So in this question, the keyword is myasthenia gravis. Myasthenia gravis, neuromuscular disorder that leads to the weakness of skeletal muscle, right? And number A, hypothyroidism, it is a condition resulting from decrease the production of thyroid hormone. And the symptoms are vary in between the individual. Like patient feel fatigue, weight gain, increase the blood cholesterol level, increase the sensitivity to cold, constipation, dry mouth. The number B, Crohn's disease, also it is called iletus or regional enteritis. Crohn's disease is a chronic inflammation of digestive tract that lead to abdominal pain, severe diarrhea, fatigue, weight loss, and malnutrition. The patient's pyelonephritis means it is the kidney infection, or also known as nephronia. Pyelonephritis is sudden and severe inflammation of the kidney due to the bacterial infection. So it is the infection. Crohn's disease is the inflammation. And last one, bronchitis. Bronchitis is an inflammation of the bronchial trees or tubules, the airway that carry the air in our lungs. It causes a cough that often brings up mucus, and it can also causes the shortness of breath, wheezing, a low-grade fever, chest tightness. So I said this is the inflammation of the lungs. This is the infection of the kidney. This is the inflammation of the bowel or digestive tract. But hypothyroidism, not the inflammation, not the infection. Myasthenia gravis is not the inflammation, not the infection. This is the neuromuscular disorder that causes the weakness of skeletal muscle. So myasthenia gravis and hypothyroidism should be good in the same room sharing, because this one not infected, cohorting. So the most suitable roommate for the client with myasthenia gravis is the client with hypothyroidism, because both or he is white, not inflammation, not infection. The client with a Crohn's disease, I mean, in the answer B, will be up to the bathroom frequently, right? Because of the frequency of defecation. The client with pyelonephritis in answer C has a kidney infection, will be up to urinate frequently as well. The client with the answer D, bronchitis, will be coughing and will disturb other roommate. So what next? Next here, the nurse is observing a graduate nurse as the assessment of the central venous pressure. Which observations would indicate that the graduate needs further teaching, right? So the central venous pressure, this is the keyword. Which observation would indicate graduate nurse further teaching? Means I'm doing something wrong and need to correct. So number A, the graduate place the client in a supine position to read the manometer. B, graduate turn the stop clock to the off position from IV fluid to the client. Number C, graduate instruct the client to perform Valsalva maneuver during the central venous pressure reading. And number D, the graduate note the level of the top of meniscus. So what is the correct answer? So correct answer is The graduate instruct the client to perform Valsalva maneuver during the central venous pressure reading. So key word here, central venous pressure, right? Central venous pressure is the blood pressure in the venous, in the vena cava, near the right atria of the heart. And central venous pressure reflect the amount of blood returning to the heart and ability of the heart to pump the blood back into the arterial system. So central venous pressure is often a good approximation of the right atrial pressure, whatever it is. So I said further teaching. So what I'm doing wrong, the graduate instruct the client to perform Valsalva maneuver during the central venous pressure reading. What is Valsalva maneuver? So Valsalva maneuver involve the forceful exhalation and can the test cardiac or autonomic nervous function, right? So the client should not be instructed to do the Valsalva maneuver during the central venous pressure reading. If the nurse tells the client to perform Valsalva maneuver, he needs further teaching, means doing wrong, need to correct. Answer A, answer B, or answer D are incorrect because they indicate that the nurse understands the correct way to check the central venous pressure. What next? The nurse is working with another nurse and patient care assistant, right? So CNA. Which of the following clients should be assigned to the registered nurse, right? Number A, the client today's post appendicectomy. So 2 days post appendix remove, appendicitis. When appendicitis occur, we need to remove the appendix surgically. We call appendicectomy. Number B, a client who 1 week postoperative thyroidectomies, means thyroid gland removed partially or full. Number C, a client at 3 days post splenectomy. So spleen is cut and removed, right? And number D, a client 2 days post thoracotomies. So which one supposed to arrange, take care of it, right? This one, because this is the most danger. 2 days thoracotomy. So the most critical client should be assigned to the registered nurse. In these cases, that is the client 2 days post thoracotomy is the most critical. The client in answer A, appendicectomy, answer B, the thyroidectomy, they are ready for discharge, they are stable. The client in answer C, splenectomy, who had a splenectomy 3 days ago, is stable enough to be assigned for a patient care assistant or LPN. What next? Which of the following roommate would be the best for the client newly admitted with a gastric resection? So number A said the client with a Crohn's disease. Number B, the client with a pneumonia. The number C, the client with a gastritis. And number D, the client with a phlebitis. So admitted with a gastric resection means gastric surgery, surgical. So the correct answer is here. Answer is D, the client with a phlebitis. The most suitable roommate for the client with a gastric resection is the client with a phlebitis, because the client with phlebitis will not transmit any infection to the surgical client like gastric resection. The Crohn's disease, it is the inflammation of the digestive tract. Crohn's disease client, answer A, have a frequent stool and also might transmit the infection. The client with the pneumonia, it is the infection of the lungs. The client in answer B with pneumonia is coughing and will disturb the gastric client. The client with gastritis means inflammation of the stomach. So it is vomiting and has a diarrhea, which is also will disturb the gastric resection client. What next? Next here, the nurse is preparing a client with mammography. To prepare the client for mammogram, the nurse should tell the client what. So the keyword is here, the mammography. For the preparation of mammogram, the nurse tell the client for what? To restrict her fat intake for 1 week before the test, to omit the creams, powder, or deodorant before the exam. Number C, that mammograph replaced the need for self-breast exam. And D, that mammography required a higher dose of radiation than X-ray. So the correct answer is B, right? To omit the creams, powders, and deodorant before the exam. So the client having a mammogram should be instructed to omit deodorant or powder and before because this could cause a false positive reading. Answer A, incorrect, because there is no need to restrict the fat. Answer C is incorrect because doing a mammogram does not replace the need for self-based exam. And answer D is incorrect because mammogram does not require higher dose of radiation than the X-ray. And what next? Which action by the novice nurse indicate a need for further teaching, right? A, the nurse fails to wear a gloves to remove the dressing. B, the nurse apply an oxygen saturation monitor to the earlobe. Number C, the nurse elevate the head of the bed to check the blood pressure. And D, the nurse place the extremity in a dependent position to acquire a peripheral blood sample. So the correct answer is number A. So further teaching, right? So nurse failed to wear the gloves to remove the dressing. So the nurse who failed to wear the gloves to remove a contaminated dressing need further instruction. Answer B, C, and D are incorrect because this answer indicate understanding by the nurse. What else? A graduate nurse is assigned the care for the client on ventilation, support, and also pending oxygen donation. So pending organ donation. Which goal should receive the priorities? Number A, maintaining the client's systolic blood pressure at 70 millimeter of mercury or greater. Number B, maintain the client urinary output greater than 300 cc per hour. And number C, maintaining the client body temperature of greater than 33 Fahrenheit rectal. And number D, maintain the client hematocrit at less than 30%. So the correct answer is, which goal should receive priorities? The answer A is correct. Maintaining the client systolic blood pressure at 70 millimeter of mercury or greater. So when a cadaver client is being prepared to donate an organ, the systolic blood pressure should be maintained at 70 millimeter of mercury or higher to ensure a blood pressure to the donor organ. So answer B, C, and D are incorrect because these actions are not necessary for the donated organ to remain the viable. What next? So here the nurse is assigned a care for infant with a physiological jaundice. Which action by the nurse would facilitate, eliminate the bilirubin? So key point is a physiological jaundice. What action by the nurse should facilitate to eliminate the excess bilirubin from the body? A, increase the infant food intake, maintain the infant's body temperature at 98.6 Fahrenheit. Number C, minimize the tactile stimulation. And number D, decreasing calorie intake. So what is the correct answer? So here, increase the infant fluid intake. So bilirubin is excreted through the kidney, or bilirubin should expel out through the kidney. So thus need for increase the fluid intake. Maintaining the body temperature is important but will not assist in elimination of the bilirubin. Therefore, answer B is incorrect. Answer C or D are incorrect because they do not related to this question. Who has a physiological jaundice and need to eliminate the bilirubin. What next? A home health nurse is planning for her daily visit. Which client should the home health nurse visit first? So it is prioritization question. A client with the AIDS being treated with a antiviral medication, Foscarnet. B, the client with a fractured femur in a long leg cast. C, the client with laryngeal cancer with a laryngectomy. And D, the client with a diabetic ulcer to the left foot. So out of 4 patients, number A patient with AIDS and being treated antiviral medication, very stable. The client with a fractured femur with a long leg cast, patient is stable, not will die. Number D, the client with a diabetic ulcer on the left foot, this patient not die now, right? Also stable. So number C, the client with a laryngeal cancer with laryngectomy, this is the danger because the client with laryngeal cancer has a potential airway alteration and should be seen first. The client with answer A, B, and D are not in the immediate danger or can be seen later in the day. What next? So the charge nurse overhears the patient's care assistant speaking harshly to the client with a dementia. The charge nurse should do what? So A, change the nursing assistant assignment, the patient care assistant speaking. Explore the interaction with the nursing assistant. Discuss the matter with the client's family. Also initiate the group session with the nursing assistant. What are the correct answer? The answer B, explore interaction with the nursing assistant. This is the correct answer. So the best action for the nurse to take is to explore the interaction with the nursing assistant. And this will allow for clarification of the situation. Changing the assignment, the answer A might need to be done, but talking to the nursing assistant is the first steps. Answer C is incorrect because discussion the incidents with the family is not necessary at this time. It might cause more problem than it solves. Answer C is not a first steps. Even though initial group session might be a plan for the future, but not now.